Hello, good afternoon again. This is Dr. Angeles, and I hope you have reviewed the basic policies and guidelines for all the subjects in laboratory medicine. So, for this afternoon, let me introduce clinical pathology to all of you. So, when you hear clinical pathology, what comes to mind? Actually, it's easy, di ba? Everything thinks it's very synonymous with what? It's very synonymous with the laboratory. Yes, the clinical laboratory where you do and get your labs done. So, the clinical laboratory plays a central role in healthcare. It's constantly evolving, especially during the pandemic. It has evolved to very basic laboratory to very sophisticated molecular molecular laboratory where you can do all the fascinating diagnostics for the COVID. Okay? So 70% of all medical decisions are based on laboratory results. But what we always teach you, especially when you get to clerkship, is never rely on laboratory tests alone. So what's inside the clinical laboratory? Besides being the facility where all the specimen of the human body does undergo pre-analytic testing, analytic, and post-analytic testing. Um, Laboratory results help us given information about the health status of a patient for prevention, diagnosis, and treatment of diseases. So we're very indispensable nowadays as an ancillary part of the hospital. So what are the following disciplines that are under clinical pathology? It may include the following, but not limited to. So you have clinical chemistry, your basic hematology, your CBCs, your platelet counts. You have your immunohematology, microbiology, of course, immunology, clinical microscopy, where you do your fecalysis and urinalysis, toxicology. This is a very specialized part of the lab wherein you get to analyze even the micronutrients, the trace elements in clinical specimen. And because of the COVID, molecular testing or pathology in cytogenetic has become an in thing. And some very specialized laboratory also include fertility testing. So, what is the purpose of the laboratory? So, as we've mentioned, to provide the clinician and other healthcare professional with information regarding detection of disease, predisposition to disease because of the use of markers, tumor markers for disease surveillance, even flow cytometry, you can do that. Confirm or reject a diagnosis, establish a prognosis for some diseases, guide patient management, and monitor efficacy of therapy. So, what are the indications for ordering laboratory examination? So, indications first, of course, confirm a clinical impression or establish a diagnosis, rule out a diagnosis, monitor therapy or management to treatment. Okay, establish prognosis of a particular disease or to screen or detect a disease. And again, you can also do wellness indicator of an individual. Okay, that's why you have wellness centers nowadays performing what you call this very basic laboratory test na tinatawag nilang mga um, ano na nga ba yun? Pag nagpapat-screen tayo, it's general check-up, executive check-up, where they do a battery of tests to monitor the health condition of an individual. So, di ba uso na ngayon yung mga executive check-up? Yan. So, we're up to wellness nowadays. So, in terms of establishing clinical laboratories. We have a clinical laboratory law which was established in 1966, which is the Republic Act 4688. It is a law that regulates the operation and maintenance of clinical laboratories. But after that, the administrative orders usually succeeding administrative orders allow some modification in the original law. So, every time meron tayong makikitang changes na kailangan baguhin sa old law, we do establish administrative orders. So, may mga ano yun, compendium orders, Republic Act, yun. Usually, ganun sila. So, how do we classify clinical laboratories? As to ownership, of course, if it's privately owned or government owned, okay? And as to classification, in terms of function, we have two basic classifications of laboratories or clinical laboratories. One is for clinical laboratories where you do all the um, tests, and for anatomic pathology naman where you do submit clinical specimen like surgical specimen taken out from patients and subject them to further histopath sectioning for examination of pathologists for the types of diseases. In terms of institution character, you have an institution based. Usually, this is tied up with a very, very large medical institution, or it can also be a freestanding. Kung freestanding naman, meron pa rin naman dyang malalaking freestanding. But when you say freestanding, usually they're not linked to a large hospital or institution. In UST Hospital, we have, of course, an institution-based type of laboratory. In terms of service capability, okay, we do have a general clinical laboratory such as pag primary, you can only do CBC, urinalysis, basic. Kasi you're only allowed to have basic equipments and a microscope. That's it. But if you go to a secondary category, you need to be able to perform chemistry o chemical analysis katulad ng blood sugar, uric acid, BUN, creatinine. Pagdating naman sa tertiary, in tertiary laboratories or tertiary categories, usually big institution ang meron tertiary category because you need to have a microbiology laboratory or at least own one section of the lab and own one biosafety cabinet for purposes of doing basic microbiology techniques such as culture, gram stain, and the like. And then there are other specialized laboratory, the limited service capability, katulad ng mga special labs which only perform like toxicology for example, there are only two laboratories in the Philippines that can perform confirmatory testing for drugs of abuse. So, dalawa lang sila. Tapos, there are smaller labs that only cater to fertility testing where they do sampling for fertility clinics, and they help these fertility clinics analyze clinical specimen. Okay? And then, of course, under that na rin is a special clinical laboratory. Okay? So, other laboratory service model examples include, aside from primary, secondary, tertiary, meron tayong tinatawag na National Reference Laboratory. So, a National Reference Laboratory is usually a big capacity laboratory. They do external quality assurance samples. They are the golden standard. Kumbaga, they give the external quality assurance samples, proficiency testing for different parts of the laboratory. For example, one national reference laboratory, which is the National Kidney Transplant Institute. They are the designated national reference laboratory for hematology. So they have a special section there. They give out proficiency testing or external quality assurance unknown samples to different participating laboratories, and they perform and grade that laboratory according to their performance in terms of doing in their performance in the area of hematology. We have a stat lab. When you say stat lab, it's also synonymous to point of care laboratory. Ibig sabihin, all the tests that are being done are at almost at the bedside, and they can provide rapid results even at bedside to provide immediate or urgent care for those who need it. Usually, the stat lab or point of care testing are found in the critical care areas of the hospital, like the ICU, the post anesthesia care unit, emergency room. And the most simple of that point of care testing is your glucometers. Okay, we will discuss that later on. In terms of human resource, a laboratory is headed and managed by a pathologist, a clinical or anatomic pathologist, or both, by who has passed the discipline of pathology and give passed the requirements of the Philippine Society of Pathology. Okay. Usually, there should be an adequate number of medical technologists or allied healthcare professionals that have undergone training and experience the conduct of doing laboratory procedures. Okay, so we mentioned earlier the three basic categories of laboratories. And in terms of equipment, paano natin i-differentiate ang primary, secondary, and tertiary laboratories? And we said, pag primary, since their service capability are very, very limited, they just need basic centrifuge, hemoglobinometer, microscope. Okay? In terms of secondary category, bukod sa meron ka ng microscope and the test, dapat meron kang photometer. Usually, mga photometer ngayon, they are already the part automated. So, pag nag-secondary category ka, at least may photometer ka dahil lahat ng mga basic tests for your chemistry are photometer based. So, the different chemical reactions that a sample undergoes to detect the element level. So, dapat meron kang at least isang photometer or semi-automated or automated chemistry machine, okay, that can perform the 5 first basic chemistries, which is your blood glucose, your total cholesterol, your creatinine, BUN, okay, and your uric acid. For the tertiary category, bukod sa dapat may microscope ka na, meron kang chemistry machine, you're capable, bukod doon, dapat meron ka ng biosafety cabinet. Kasi dapat, in a tertiary laboratory, dapat nakakapag-offer ka ng services ng microbiology lab. Okay, so dapat kapag tertiary category in terms of equipment, ang difference dun sa tatlo, dapat meron kang biosafety cabinet. Okay. In terms of physical plant, ang tinatandaan lang namin dito palagi, 10, 20, 60. Pag 10, pag primary, dapat 10 by 10 square meters for you to operate a basic primary lab. If you go up to secondary category, dapat at least 20 by 20 and so on. Pag tertiary category, there is a minimum of 60 by 60. So there is no limit to how large a laboratory can be if you have a tertiary category. They can get as big as the whole floor being the laboratory alone. Okay. In terms of design, meron tayong tinatawag na closed at saka open laboratory. Pag sinabing closed, every section in the laboratory is compartmentalized. Kapag sinabi mo naman ng open laboratory, it's all integrated because most of the open laboratory nowadays have integrated, fully automated procedures. So, kung iiwanan mo na lang sa isang rack yan, pagsakay nung tube from HEMA, it can go up to chemistry, up to serology and immunology. So, very, very integrated system na tayo ngayon. Even yung pag-sort out, paglagay ng barcode sticker, pag-determine ng hemolysis ng blood samples is already automated in some very, very big laboratories. Okay. In terms of policies and procedures, a laboratory has to have written policies and provision of laboratory services. Kailangan nakasaad din doon kung kailan nag-ooperate and kailan dapat na ma-maintain ang laboratory. So, usually, ang licensing ng laboratory lasts for a year. And then after a year, you apply again to DOH under the Bureau of Health Facilities and Services. So, every year, nag-a-apply dapat ang laboratory sa licensing. Okay. Pag sinabi naman natin technical procedures, usually dapat may mga bench manual tayo na pinaperform sa bawat section ng laboratories. It's basic. And in terms of quality, dapat, if you're operating a clinical laboratory, dapat you have to have a continuous quality assurance program. Meaning, you're not just performing the test, but you have that capability to be checked by an external body. We've mentioned a while ago, di ba, yung mga, anong tawag natin dito? Yung mga laboratories that are assigned to do proficiency testing and quality testing for all the member laboratories. So, why is quality assurance very important? Because dapat sa lahat ng nare-release natin na results in the laboratory, dapat confident ka that it's precise, you're up to par with the other laboratories, at kahit papano, you have the confidence to release that your results done in your laboratory are accurate and they're reliable in terms of output.
Hi, Mommy. Hi, Mommy.
Okay, may commercial break po tayo. Okay. External quality assessment program. Like part of your quality assurance program, you have to participate with external quality assessment program which are given by your what? Reference laboratory. So, si reference laboratory, they give out unknown sample sa mga participating laboratories. So, they give unknown samples and then the laboratories will run it as one of the clinical specimen. And then after running them, they return it back to the external to the reference laboratories for assessment. And then the reference laboratory will tell them and give them in the report on how they will be able to how did they perform in terms of their peers. Okay. National Reference Lab, we've mentioned this na. Like the RITM. The RITM is a good reference laboratory in terms of infectious disease. So, ngayon sa pandemya na ito, the NRL ang palagi nating pinupuntahan for golden standard or proficiency testing or bago tayo makapagtayo ng isang PCR lab, dapat aprobado ni RITM because they're the National Reference Laboratory for Infectious Diseases. So, let us identify other national reference laboratories. So, meron tayong NKTI, which is in charge for hematology. We have East Avenue Medical Center for toxicology and water analysis. Toxicology in terms of being the national reference laboratory for drugs of abuse. Okay? So, for Serology, we have the SACEL under San Lazaro. They are in charge for uh, serologic tests like your hepatitis, your VDRL for Treponema pallidum infection, and then we've mentioned the RITM for infectious disease, and the Lung Center of the Philippines, which is the reference laboratory for chemistry. We've mentioned earlier point of care testing. So, when we say point of care point at point, so bedside usually yan. So, what are the other terms that are used synonymously to point of care testing? So, you have alternative site testing, near patient testing, bedside testing, and decentralized testing. So, usually, we've mentioned earlier, at the site of patient care, in the ward, in the OR, in the ICU, in the emergency ward. So, usually, eto mga to, either handheld device or cassette or benchtop devices. So, usually, itong mga to, they offer very, very rapid turnaround time of results because they have faster assessment of health status. They have, they can also help to decrease the morbidity and mortality of the patients because they give rapid results without waiting. But still, the golden standard pa rin is to be able to confirm the results of your point of care testing and send it over to the main laboratory for the, kumbaga ito kasi shortcut eh. At pag you send it to the main laboratory, you do the usual process. Yun nga lang, sometimes it takes longer. Okay? So, what are the test processes that are involved in the laboratory? You have pre-analysis, analytic or analysis, and post-analytic process. In the pre-analytic part, usually pag pre-analytic part, ano yan, this is where a critical portion of the laboratory testing takes place. Why? What is pre-analytic process in the laboratory? This is the part where you do um, a specimen collection, specimen identification, um, specimen um, analysis if it is fit or unfit for testing. Okay, so dyan nangyayari lahat. So, pag meron kang mali sa pre-analytic process, syempre, yung ipapasok mo for analytic testing, may magkakaproblema na rin eventually. So, pinaka-importante at critical pa rin si pre-analytic phase of the laboratory process. When you say analytic naman, ito, testing proper na. So, usually, kapag dumaan siya sa strict pre-analytic um, scrutiny, pagdating sa analytic process, medyo konti na lang yung ano natin, magiging problem natin. And when we say post-analytic, this means that you are tagging the specimen um, for release or you are now ready to release the results. So you just verify and then you release the results accordingly to your patient. So what are the common laboratory errors? So we've mentioned a lot the three basic analytic process in the laboratory. So pre, analytic, tsaka post. Most of the time, karamihan sa mga laboratory errors talaga, siguro 50 to 60% clerical. In terms of first, wrong identification of the patient, halimbawa wrong patient preparation, tapos halimbawa hindi nasabi na naka-IV pala yung patient, sa ibang catheter site pala nila kinuha. Usually that's the common errors that we do encounter in the laboratory. And I've mentioned some examples of laboratory errors that you can encounter during the three basic process. So in the pre-analytic, wrong yung collection tube, improper yung storage. Sa analytic, pwedeng calibration error na ng machine or nag-malfunction yung machine, hindi siya nakahook sa isang um, uh, anong tawag dito, isang UV, yung nag-preserve ng uh, electricity surge, tapos nagkaroon siya ng konting malfunction because of power surge. And then in the post-analytic error, usually napapadala sa ibang patient, sa ibang doktor, missing reports. So those are examples of laboratory errors that we encounter in the three analytic phases of the laboratory. Okay, laboratory informatics. What is laboratory informatics? Very, very um, helpful in terms of speeding up the turnaround time of results. So the laboratory information system, LIS as we call it, usually refers to the following. So pwede kang magkaroon ng digital pathology, document imaging, um, releasing of results via online, via direct to the computer portal of the hospital. So there's a lot that's happening in laboratory informatics. So it's the aspect of pathology that focuses on the management of information and system in support of patient care decision making, education, and research. Okay. Pag sinabi nating LIS, mas ano lang, particular lang or mas specific lang sa laboratory. So, it supports workflow and information flow within the laboratory for a faster testing process. Okay. So, since we're done, last but not the least, we should always bear in mind laboratory safety. So, inside the laboratory, katulad nung nasa undergrad kayo, if you have more chemistry subject, we're always being constantly reminded of laboratory safety in terms of being exposed not only to biological hazards, also being exposed to chemical hazards, ergonomic hazards in terms of how you work in the laboratory, and fire, because we do also have some fire safety precautions. In terms of biologic hazard, like ngayon, we have COVID and we have tuberculosis and we have hepatitis. You always bear in mind that as soon as you get a patient sample, always consider that it could be an infectious substance. So we always say and always tell them to practice universal precaution. Always treat a laboratory or clinical specimen as an that has an infectious potential. So the proper use of personal protective equipments, the use of sharp collectors, and the proper handling of sharps and sharp materials after being used is always practiced inside the laboratory. Okay, in terms of chemical hazards, everything or every chemical, be it in minute or large quantity, that is used inside the laboratory should always have a material safety data sheet. The material safety data sheet is an information catalog wherein you can see basic properties of the chemical that you are using in the laboratory. So you can do basic first aid. For example, natapunan ka ng isang chemical sa laboratory, nagkaroon ka ng minor spill, you would know how to handle that chemical spill. So, dapat sa laboratory din, bukod sa meron kang material safety data sheet, dapat meron kang basic spill kit and first aid kit and eye wash kit. Ergonomic hazards. Okay. When you do perform tests inside the laboratory. And of course, this affects most of our medical technologies. Do you have a good chair that supports the back of your medtech while she's performing a specific task? Kasi imaginein mo, if you're performing that task for 8 hours and then nakatayo ka lang, wala kang upuan, mainit yung lugar mo. So, wala kang adequate lighting. So, it poses an ergonomic hazard to your worker inside the laboratory. And last but not the least, fire hazards. So, in the laboratory, when you're handling chemicals, dapat lahat sila meron universal fire symbol. Kung if they are flammable or corrosive or oxidizer. Okay? So, these are some lab safety rules that you can see in the laboratory. Okay, so stay safe. So dress appropriately, wear the correct PPE, mind the infectious disease hazard, biologic hazard, poison, fire hazard. Do not eat inside the laboratory, of course, and handle glasswares and sharps carefully. And last but not the least, clean as you go. Okay, so these are the basic symbols that you will see in the laboratory. Okay, ito yung pinaka-importante, yung biohazard symbol that usually you see them outside the microbiology lab. Okay. Radioactive hazard, you usually see this in where? You see this in radiology department, tsaka nuclear med department, di ba? Okay. So I think this is my last slide. I hope you learned something. This is just the basic. I won't be giving you a post test after this, but next week siguro probably when everybody has already finished enrolling in the course. So that's it. Thank you very much for your attention. And if you have question, feel free to comment on our discussion board. So thank you very much and good day, everyone.